Okay, so once again, good evening, everyone. This is the third live session for the course Affective Computing. Okay, so let me introduce myself briefly. I am Akanksha, a PhD student at IIT Ropar in the CS department, and I'm the PMRFTA for this course at NPTEL. And the course instructors are Professor Janendra Shukla and Professor Abhinav Dhal. So let's just briefly go through the dates, important dates. Your exam date is 26th April, and I request you to, please keep checking the website regularly for more updates and your mail. I think you must be receiving all the updates through mail as well. So, for today's discussion, we have the topics which is the experimental design, affect elicitation, research and development tools. Now, in this live session, as you know, what we do is we will discuss the previous year assignment questions so that you're able to understand the concepts in a problem solving manner and you're able to solve the current assignments. So, also, as you know, Anshul, you have been joining us since past two lectures as well. So, please write the answer in the chat box. And then today we have around 30 questions to discuss. So it's going to be very, I'll try to move fast. Yeah, let's start. So first question is, what is the process through which emotions are induced among human subjects? Emotional transference, psychological projection, emotional elicitation, or cognitive dissonance. Even if you don't know the answer, just try. See, emotional elicitation. Okay, so let's go through these options one by one. The first term is called emotional transference. Now, what exactly emotional transference means? It in psychology, it is a phenomena in which one seems to direct feelings or desires related to an important figure in one's life. For example, your parent, your teacher, such as parent, or towards someone who is not that person. I mean, if I have some kind of experience with you, then I might project my feelings onto someone else uh, because of what I had as an experience with my parent or with my teacher. So, in the context of psychoanalysis and the related forms of therapy, a patient is thought to demonstrate transference when expressing feelings towards the therapist that appear to be based on patient's past feelings about someone else. Um, example, example like you transfer your feelings from one person to another. Example is if a patient's mother were extremely judgmental to her as a child, you if like your mother used to comment on something and then you go to therapy and then the therapist makes a similar comment, then you kind of relate to that old scenario that your mother also used to do this to talk about the same topic, and then you might perceive the therapist as judgmental, and the patient might express that, even lash out at the therapist. So this response, why did this response come in the first place? Because you are interpreting, like, as her applying to her therapist the same feelings that she felt towards her mother because she had some past experience. You can say the same situation is being experienced again, and the person finds them in the same situation again, and they try to respond in the same manner as they would have responded in the previous situation. So, this is the emotional transference. So let me just highlight. Let's use this. Okay. So the next term is called psychological projection. Psychological projection, it is a defense mechanism in which an individual attributes their own unwanted feelings, thoughts, or motives to another person. That means, if I am, for example, if I am insecure about myself, about something that I don't like about myself, and I would say something related to it to the other person. So example is like instead of acknowledging my own emotions or conflicts that I have or my insecurities, for example, a person unconsciously assigns them to someone else. This allows them to avoid dealing with uncomfortable feelings because they feel better that, oh, it's not my fault, it's the other person's fault. Example is a person who is feeling jealous might accuse their partner of being jealous instead. Uh, but actually, what is happening is you are experiencing the feeling, and now you're saying that the other person is feeling that way, just to take you out of the guilt and just to not feel uncomfortable. And a student failing an exam because he did not study might claim that it's the teacher's fault that they did not teach well. So it's like अपनी अपनी प्रॉब्लम्स या अपनी uh, किसी पे थोपना मतलब you're just telling someone else that you are wrong. Then comes emotional elicitation. Elicitation is the term when you it is the process of inducing emotions. So this is the correct answer. This is what we use to induce the emotions while we are experimenting with the help of specific stimuli or experimental techniques. So usually it is used in psychology, neuroscience, whenever we are using some kind of affect sensing mechanism. So we can use this emotional elicitation to induce particular emotions that we want to. So how does it work? The researchers and experimenters, what they do is they present emotion evoking stimuli. Stimuli, for example, the stimulus can be an image, a video, or a music, whatever, and they ask the participants to engage in tasks that are designed to trigger that specific emotion. The goal is to observe, measure, and analyze the emotional responses. For example, I want to see how good a person feels by watching a certain video. Let's say, uh, as we discussed in one of the previous lectures, there's a term called neuromarketing. Now, neuromarketing, what it does is they just they will show you, for example, you are designing advertisements. Now, advertisements you're designing, but how do you know do they are really good or not? So what you can do is you can show it to some people, and in order to include more people, you can what you can do is you can do it online, right? You can just show them and record their facial responses in return. Now, what you're doing is essentially you're trying to induce a emotion of happiness. Now, you're showing them the video. It depends what kind of emotion they are feeling. If it is aligning with what you are trying to achieve, then that means your advertisement is great. Otherwise, you need to make some changes. So you can get some feedback. So the goal is to observe, measure, and analyze emotional responses, often using physiological signals, heart rate, skin conductance. You can put some sensors as well. If it is a laboratory setting, then what you can do is put some sensors, show them the stimulus. For example, some images which are very happy, a child is playing in the playground. So it is more of a happy memory, a happy image. And then you can show them some sad image, like somebody dying or accident. So it is very, the person will feel sad about it. So you can induce sad emotions. So this stimulus can be of multiple types. So first is the visual stimuli. Participants can view something, for example, the images or the videos. Okay, for pictures of smiling people to elicit happiness, or disasters to elicit sadness or fear. Now, auditory stimulus is also there. Auditory stimuli means sound, anything sound based that you hear. So you can play some kind of music or some kind of speech, whatever. So, example is listening to joyful music. It can evoke happiness, and suspenseful music. If you talk about any movie which is thriller, so the background music must be something like which evokes the uh, suspense. So it also should induce some kind of fear. So yeah, auditory stimulus is stimuli can also be used. Then there comes task-based techniques. Now, another this task bit, what does it mean is that I would tell you to recall something. Like I would say, do you remember when you won something, like won the first prize in the race that happened during your childhood? You will think about it and you will feel happy. Since it is a happy memory, then you will feel happy. Similarly, I can, if I want to you to be sad, to experience the sad emotion, then I can tell you to remember some kind of accident or some kind of loss that you have gone through. So you will feel sadness. And the fourth term is cognitive dissonance. Cognitive dissonance, what exactly it means is it is a psychological phenomena that occurs when a person experiences discomfort or tension due to holding conflicting beliefs, attitudes, or behaviors. Now, the key point here is that it is inconsistent. Now, what inconsistent means is I am saying that, smoking is injurious to health, but then I smoke cigarettes. Then it is conflicting behavior. How people justify this behavior? Because this is a like fact that everybody tells you that smoking is not good for you. But if you still smoke, then you kind of try to justify why did I do that? Now, how this cognitive dissonance actually works, people are motivated to reduce the tension by either changing their beliefs. So maybe you can think, okay, it is not that injurious to your health, so it's fine that I smoke. Or justify their actions, like why did I do? I was feeling too stressed, that is why I smoke. Uh, Ignoring the conflict, like you can choose to ignore. So this is not a emotion elicit, like it is not the process of inducing emotions. Example of cognitive dissonance can be a person who values health, like they are very health conscious, they don't eat junk food, they don't eat sugar, but then they smoke. This is contradictory, right? So they can experience this cognitive dissonance. They, to resolve the tension in their mind, they might change their behavior. They might say, okay, they may say, okay, I will quit smoking, and then second thing they can do is they can justify their behavior. I only smoke socially. I don't do it often. And the third is minimize conflict. The health risks of smoking are exaggerated, so they you don't even believe in that. So, in a psychological experiment, participants might be asked to perform a task against their beliefs to create dissonance. Okay, so if I tell you like I don't dance, if I tell you to dance, then it is contradicting your current beliefs. So it is difficult for you. So I'm creating a cognitive dissonance. So the correct answer is C in our case. Okay. Next question is the ecological validity of data becomes a significant concern when dealing with acted or posed expressions. True. Okay. So, what exactly are acted or posed expressions? Acted expressions are they're deliberately performed. It's not something that you're experiencing naturally, but you're acting them out. Deliberately performed emotions by individuals. For example, actors are mimicking something like they're smiling, they're laughing, but it's all fake. Posed expressions are facial expressions or gestures which are created intentionally upon request, often in laboratory settings. If there is an experiment going on, and I tell you, okay, now you have to be happy. You have to pretend to be happy. You're not exactly happy, but then you put a smile on your face, which is a fake smile, right? It's not naturally induced. So, what is the problem with these acted and posed expressions is they are not spontaneous. They're not spontaneous. What does it mean? And often exaggerated for clarity. Now, these two are very good points because number one is non-spontaneous. Not spontaneous means that you're telling the person to enact those expressions. If a person is telling me to smile, I might smile like this, but this might not be how I actually smile. This is my fake smile, right? So this is non-spontaneous and often exaggerated. So now the person has made me conscious. I am very conscious that I have to smile. I will not smile in the natural way. So I will most likely like do a forced smile or forced surprise expression. So what exactly is happening is we are exaggerating uh, the emotions, the expressions, okay? And we want that it should be clear, but in natural setting, it's not there. In natural setting, there might be multiple variations, so they are less natural than the real world emotional expressions. Now, what exactly is ecological validity? Ecological validity means you can say the credibility or the authenticity, right? So if there is a thing which is real versus artificial expressions, since they do not fully capture the subtleties, spontaneity or variability of emotions that occur in the natural settings. Example, a person smiling in a posed photo may not show the same micro expressions. Do you know about micro expressions? Sometimes expressions are something that we can notice, but micro expressions are something that we fail to notice because they are very minute movements of our facial muscles. Okay, if somebody is actually experiencing joy, the eye region might also have some kind of lines here because I'm laughing so hard that I'm closing my eyes and I am also experiencing some kind of lines here. However, if a person tells me to laugh, I will fake laugh like ha ha ha. So that means I'm not, it is not a representative of how it actually happens. Now, the second point is overgeneralization risk. Overgeneralization, what it means in this context is, uh, since we are training our models on these acted or posed expressions, now whenever the model will be deployed in a real world setting, it won't be able to perform that well. It won't be able to perform that well because the the training that has been done on the unnatural data, but now we fail to like we have to perform well on the natural data, which is way more it is very different from what we train our model on. So this is overgeneralization risk. Then comes the cultural and contextual differences. Uh, whatever feeling happy in one culture may be different from feeling happy in other culture. If I tell a person in my laboratory setting that you have to smile, but for the smiling might represent something else, like the intensity might be different for different contexts. So we cannot say that the acted expressions or the posed expressions are good representative of the real world. They are not. That is why they are, but the posed expressions are more standardized, ignoring cultural variations or the situational context, right, which can influence real world expressions. Now, definitely, it becomes a significant concern when dealing with acted or posed expressions. Third question is, um, Aparna and Shikha, since you have just recently joined, and Dhanya as well, so you've just joined, I will repeat some points that we are here discussing the previous year assignment questions from the same course. This is the 2024 iteration of the course, and these assignments we are solving. Um, if you like, please try to answer the questions. If you even if you don't know the correct answer, just try. They are very more like I would say more theory based, so it is okay to guess. And please write your answers in the chat box. Every time we are discussing a question, we will wait for around 30 seconds for you to answer in the chat box, and then we will move on to the discussion. Dhanya, do you have any question?
Actually, yes, ma'am. Actually, we're not able to attend all the classes. Where will these videos be posted, ma'am?
Yeah, so these sessions are recorded and they are posted on my personal YouTube channel, but the links, they are all public videos and the links will be shared through the NPTEL. I think they must be sharing the links with you already.
You have to like check the affective computing that any channel is there.
Sorry,
Like which channel?
channel. I'm unable to, know the exact question. What I understood is
I
that
just want to know where it is being posted, ma'am. Like you said, official NPTEL, so where?
no, no, it's not on the official NPTEL. These sessions will not be on the official NPTEL channel. It is on my channel. And these links for every video will be shared with you. I guess they might be sharing through mail or something. Or there is also a Google Drive folder where all of these slides will also be uploaded. So you can refer to them later. So the session for the 2 hours complete duration, it is being recorded and it will be uploaded. It will be available
Yes,
in
ma'am.
next. Yeah, yeah. Okay. So today we are going to we have been discussing the previous two questions we have already done. Now we have to complete around 30 questions, so it will be very interesting and I'll try to cover as many concepts as possible. So I'm explaining in detail. Just in case you don't understand anything, you can always raise a hand, always type in the chat box, so we will go through it again. Okay? So please, everyone, try to answer this question. The recall method is a form of passive technique for eliciting emotions. I'll just wait for 30 seconds, then we'll start discussing. Anjali is saying false.
Ma'am, actually, I'm having another meeting, ma'am, so I'll not be able to fully listen the class, so I'll just not be able to answer it, ma'am. Is it fine? So in case you call me.
It's fine,
Yes, ma'am.
Danya.
Just because we're very less people.
It's fine. So, okay. So let's jump on to the explanation. Now, for the emotional elicitation, we just discussed what is emotional elicitation. It is the process of inducing emotions during some kind of experimentation. People use these different techniques or stimuli to induce different kind of emotions. Now, what are different methods? There are two kind of methods. First is called the active method. Second is called the passive method. So they can be classified into active and passive methods based on what is the basis? Based on the level of engagement and effort required from the participants. For example, there is an experiment going on, and there can be two types of emotion elicitation methods. Let's see one by one. What are active methods? Active methods require direct participation and cognitive or behavioral effort from the individual, which means that I want the active participation of the current participant. Okay, the participant is actively engaged in a task or behavior or a thought process to evoke emotions. Example, they what are the characteristics? First, let's discuss the characteristics. The individual must intentionally recall, imagine, or respond to a specific prompt. Then it also requires mental effort for physical interaction. Um, Often involves guided instructions to generate emotional responses. I can tell you to think about some happy incidents from your childhood. That means if you will recall or remember those incidents, what will happen is you will feel good about it. Now, I want to induce happiness in you, then I will tell you to recall good incidents. If I tell you to recall something bad happened to you, so it will induce fear or sadness. So that is how you are thinking about it. You are actively participating in the this process. So this is the active method. Then Examples are recall-based techniques. Participants are asked to remember and relive the personal experiences associated with the target emotions. Example is recall a time when you felt very proud, like you won this trophy. Second can be imagery-based techniques. Participants are instructed to imagine themselves in a specific situations. So first point was it already has happened and you just want to recall the memory that okay when you were in this class what happened. Now the second point is imagery-based. That means you are using your imagination to imagine yourself in certain situation, a specific situation to evoke a emotional response, which is example, imagine yourself standing on stage in front of huge audience. That means the person might feel nervous about it already just by thinking. It might evoke anxiety. Now, interactive tasks can also be there. So I can tell you to solve a puzzle and I can tell you to solve this puzzle in 30 seconds only. Now, what will happen is since you will be having a lot of mental pressure on you, like I have to solve this puzzle in 30 seconds, then it gives us like under time pressure, we can evoke frustration or anxiety, right? Then role playing or acting. That means the participants, group of participants, they can be asked to role play or a scenario. For example, pretending to argue with someone. If two people are arguing in front of you, you might also feel, uh, s- angry, and the people enacting those moments, they're also going to feel some kind of emotion that we want to induce. So we can generate emotions like anger or embarrassment or these kind of emotions. Now, the second type of methods are called passive methods. They require minimal engagement from your end. So whenever you are a participant, you don't have to do anything. You just have to watch a video or look at a picture, for example, right? So it is evoked through external stimuli and participants passively experience the emotional response. What will happen is if am sitting in front of this my laptop and I'm a part of an experiment and I have these skin conductance electrodes on my fingers. So what will happen is whenever there will be a video which will induce fear, which is supposed to induce fear, then it I should experience high skin conductance or high sweating, right? So that is how we measure. But I am not doing anything. I'm just looking at it. It's not that it is requiring any kind of mental pressure, mental effort from my end. I'm just looking at it passively. So I'm just reacting to an external stimuli without actively creating or imagining the situation. Now, it requires little to no mental or physical effort, and usually what happens is we use standardized materials to ensure consistency across participants, right? Why standardized? Because um, it might also be possible that if I want to induce happiness, then I cannot just show you my image and I expect you to all feel the same. But there are certain data sets which have certain images that are like proven to induce the particular target emotion. So we only use the standardized materials. Uh, Many examples can be there for the passive methods. The first is visual stimuli. First is the visual stimuli. The participants are shown images or videos designed to evoke specific emotions. Is there any chat? Okay, sorry. Yeah, so visual stimuli. Participants are shown images or videos which are designed to evoke specific emotions. For example, this is an example of the dataset that I was talking about. This is called IAPS, which is the International Affective Picture System. They have some standardized categories: happy, sad, fear, so some disgust. So these images or videos are associated with that particular emotion. So yeah, then movie clips from The Lion King. It is a some sad parts are there and or Titanic for love. Um, Then comes the auditory stimuli, that means listening to something. Then you can listen to music or sounds associated with certain emotions. If you um, listen to some upbeat music, you might feel happy. Or like sirens or ambulance sirens, you can, if you listen to those, you feel somehow, you feel anxiety and fear. Then environmental manipulation, changing the physical environment, dim lighting and eerie sounds to evoke fear. Bright lighting, it is more pleasant, and good, like pleasant aromas to evoke calmness. Facial expression watching. Participants watch others displaying specific emotions. Example, actors playing joy, anger, or sadness. Watching a video of someone crying to evoke empathy or sadness. So these are some examples for the passive methods. Let me highlight these. Okay, so the question was recall method. Let me, yeah, this is the question. The recall method is a form of passive technique for eliciting emotions. As we discussed, the recall method means that I'm telling you to recall something, remember something from your past, which already has happened, a happy memory, a sad memory, whatever I want to evoke. So I'm telling you to actively participate. You're actively thinking about it. So it is more of a active technique. So let's just formally see. It is involves asking participants to remember and mentally relive a personal experience or event that evoked a particular emotion. Now, they can be asked to reflect on a happy memory, such as a birthday celebration, right, or a promotion to elicit happiness, a moment of loss or failure to evoke sadness, an embarrassing or frustrating moment to induce emotions like shame or anger. Now, given that participants must consciously behave or think about a specific situation, the recall method is an active technique, right? Okay, next question is, okay, let me just take it then. Okay, next question is, in human-centered research, what should be the primary consideration when conducting studies involving individuals? Please write your answers in the chat box. Anchal is saying C. Anyone else? Okay, let's see. What exactly, like how important is human in human-centered research? In human-centered research, the primary consideration must be always the rights, welfare, and dignity of the participants involved. Other factors are also important, but not as important as something, these ethical considerations, right? So these ethical guidelines and standards are there in place to ensure that the participants' well-being is the priority over other considerations like funding, data analysis, or the publication goals. Okay. The funding availability, um, irrelevant as a primary consideration, not irrelevant overall, but irrelevant as a primary consideration. While funding is very important, it is the backbone for conducting any kind of research, it is not more important than ensuring the ethical treatment of participants, right? Then comes the data analysis part. Now, the data, it should be the secondary priority, like it focuses on studies outcomes, right? But it should only be conducted once the participants feel safe or they are treated ethically. And after that, publication of results it is more of a outcome focused thing. So it is also very important. We look forward to some kind of output coming from whatever we are doing, but it must not come at the expense of participants' welfare, right? Ethical violations can lead to retractions and harm a researcher's credibility as well. So, yeah, these factors are important, but the most important um, factor is the rights and welfare. How? We should respect the autonomy, like they should be able to take decisions for themselves. They must voluntarily agree to participate in the study after being fully informed of its procedures, potential risk, very important, benefits, right? Benefits is fine, but it should also tell the people about the potential risks involved because that is the most important thing. Then protection from harm. Um, if any kind of harm is done, then how are we responsible? The researchers must ensure that the participants are not exposed to physical, emotional, or psychological harm during or after the study. For example, there is some chemical study. Now you cannot just use a person to check whether the chemical is reactive or not because it can cause physical damage, right? So it is not allowed. In emotion elicitation research, participants recalling traumatic events must be carefully monitored to avoid distress. Maybe you will disturb a person just by telling them to recall something very, very disturbing to them, and they have recovered after so long, but then you just spoil everything. So that is not done. It is not acceptable. Then comes the confidentiality and privacy. Now, the personal data collected from anyone during the study, it must be handled securely and kept confidential. Not that you've just completed the experiments there is publication and then you forget about uh, the data. Sometimes the data might be very sensitive. For example, medical data. A person might not want to reveal to anyone whatever complications they are going through, right? So it is a duty of the researcher to ensure the confidentiality and the privacy. So if participants share sensitive emotional experiences in our case, their identities must not be disclosed in the publication results, right? Then comes the fair treatment. You shouldn't be biased towards any category of people. Example, there shouldn't be any kind of racism. There shouldn't be any kind of differentiation. Um, and participants should not face any kind of exploitation as well. And the vulnerable groups, which are the children, elderly, women, and those with any kind of disabilities, they must receive additional protection, right? So, the correct answer is rights and welfare. So, Ajal and Shikha, you both are correct. Let's move on to the next question. Which experimental design involves testing the same group of participants under different conditions to examine the effects of an independent variable? Between subject design, within subject design, both A and B, and correlation design. Anjali is saying between subject design. Anyone else would like to answer? Shikha is saying C, both A and B. Anyone else? Okay, what exactly is the question? It involves testing the same group of individuals, same group of participants under different conditions. Now, this is called within subject design. Why? Because it is an experimental design with the same group of participants is tested under different conditions or levels of the independent variable. It allows researchers to examine how changes in the independent variables. Okay. How changes in the independent variable affect the dependent variable within the same individuals. It reduces the variability caused by individual differences. Let's take an example. Uh, Firstly, let's go through some key features. So, same participants across different conditions. We want to check the efficiency of a system or whatever you have designed. For example, simple example, a medicine, right? Um, there is a medicine which can reduce stress, let's say. Now, you want to study. So, you take like you give some homework to a group of participants, and you don't give them any kind of medicine. Now after another, like next day, what you can do, you tell the same people to solve a similar problem, and then you also give them the tablet that you want to check, test, right? Now you can observe the difference between the same people performing the same activity, but the additional thing is that you want the new medicine is introduced, right? So, same participants across conditions, all participants are exposed to all experimental conditions or treatments. Now, control for individual differences are same participants are used across conditions. There is no variability caused by differences between participants, age, personality, or background. So, since it is the same set of people, and then statistical power also, uh, like you also require lesser number of people, right? Fewer participants are required than a between subject design, because then each participant has their own control. Um, Somehow it is easier to determine the difference with a smaller number of people whenever we are doing this within subject design, rather than between subject means the person will change. Okay, example can be experiment on a memory recall. A researcher wants to study the effect of background noise on memory recall, let's say. Now, condition one is participants will study and recall words in a quiet room. There is no noise. And then the same participants will study and recall words in a noisy room. Now, if they are unable to recall the words when they are in the noisy room, then that means the background noise impacts their cognitive power, right? By comparing their performances under both the conditions, the researcher can analyze how background noise affects memory. So, then what are the advantages? We have already discussed these, like the participant variability is reduced and efficiency is increased. We need fewer participants, and the disadvantages are order effects. Now, one disadvantage can be the sequence in which conditions are presented may influence results. For example, fatigue or practice effects. Um, Maybe the order also matters in some cases, maybe not in this noise task, but maybe in medicine A and medicine B. So if I give medicine A first and then medicine B, then there might be different outcome. And if I give that to medicine B first and then medicine A, then it can also cause a different outcome. Now we want to compare the both. Uh, how we can counter this? You can use counterbalancing, like the order of condition is varied across participant. For every participant, you can decide randomly what will be the sequence. Dhanya, do you want to say anything? I'm unable to listen to you. Dhanya, I think it is by mistake. Can I? Okay. So, let's get back. Other designs are between subject design. It involves different group of participants for each condition. Medicine A will be tested on group A and medicine B will be tested on group B. So it is exposed, each group is exposed to only one level of this independent variable. In a study of noise and memory, Group A studies in a quiet room and Group B studies in a noisy room. Correlational design is it involves examining the relationship between two variables without manipulating them. Okay. Uh, Studying the correlation between hours of sleep and test scores. You're not designing something, or you're not manipulating anything. You're just observing the relationship between two correlation between two variables. So this is a correlational design approach. Now, okay, the correct answer is within subject. Next question is, okay, if you have any doubts, you can please let me know. Okay. Uh, okay. What is the purpose of data annotation in the context of collected data? To enhance data collection methods, to create ground truth for the data, to summarize collected information, and to validate the accuracy of the data. Anshul says to create ground truth. Anyone else? Shikha is also saying B. Okay, what exactly is data annotation? It is the process of labeling or tagging collected data to provide some ground truth, which means it serves as a reference or a baseline, you can say, for training machine learning models. Right? The purpose of annotation is to add meaningful labels or the metadata that make the data usable for supervised learning approaches. Right? Now, the ground truth refers to the accurate and reliable labels or classifications assigned to the data which machine learning models use as a benchmark to learn and make predictions. Example, in an image classification task, which is between cat versus dog, the cat and the dog, they are the labels and the ground truth. In speech recognition, transcribing audio into text is an example of ground truth creation. Okay, so the correct answer is to create ground truth. Okay, next question is, what does valence refer to in affect classification? We have discussed this in previous lectures as well. Positivity or negativity of emotion, intensity of emotion, duration of emotion, frequency of emotion. Okay, Shikha, I will share in the end of this session. I will share in the chat box, or meanwhile when you are answering the questions. Okay. Okay, Anchal is saying A. Shikha saying A. Okay, so valence is in the affect classification. It refers to the positivity or the negativity of an emotion. Uh, Definition is, the positive valence means that emotions like happiness, excitement, and love, where you have a pleasant experience. And the opposite is called the negative valence, where you experience some negative emotions such as sadness, anger, and fear. Now, the role in emotion classification is it helps to classify whether an emotional experience is pleasant or unpleasant, right? And often represented on a continuous scale in models like VA or VAD, PAD models. Pleasure or valence is the same, right? Now, the correct answer is positivity or negativity of the emotion. Question number 8 is, what is the key benefit of incorporating naturalistic expressions in studies on emotion recognition? Consistency across cultures, easier annotation and labeling, enhanced ecological validity, higher number of citations. Higher number of citations. Okay, let's see. So, naturalistic expressions, what they exactly mean is the opposite of acted or posed expressions that we just discussed in the beginning of this lecture. What exactly is acted or posed? You're telling someone to behave in a certain way, to give some expressions which refer to happiness. For example, telling me to uh, you know project happiness. So how would I display happiness is by smiling, right? This is not a natural representation. How I smile in a naturalistic setting, that means having a conversation with my friends, how I smile is different from what I did here. That means their natural expressions are more spontaneous. They're more spontaneous and genuine emotional expressions that occur in real world contexts rather than being deliberately acted or posed. Now, the person is smiling during a genuine conversation or frowning in frustration. Comparison with acted expressions is acted are exaggerated, as we already discussed. They are exaggerated or artificial, often used in controlled settings. Naturalistic are more subtle, context dependent, and they hence more realistic, right? Now the naturalistic expressions, they better reflect how emotions are experienced and displayed in the everyday life, and it is more closer to the how things actually happen. So in case of any study involving these naturalistic expressions, the ecological validity is improved. That means whatever we are studying, it is more relatable. It has more credibility associated with it, right? It's not. It's a good representative of the actual world. So it is more reflective of real life emotions, more culture norms, and they they need not be consistent, but then we can see based on the context what is happening. So a better representative of the emotions. So the correct answer would be enhanced ecological validity. You understood the ecological validity term, right? Ecological validity is the how well our study is representing the real life scenario. Okay, next question is, which statement accurately reflects the ethical considerations in research involving human subjects? Data collection can commence immediately without any IRB approval. IRB approval is optional for data collection. Data collection should wait until obtaining IRB approval. IRB approval is only necessary after the completion of data collection. C. Vishal C. Shikha C. Shikha, please mute yourself. Okay, so what exactly is IRB? IRB is Institutional Review Board. It can be specific to your organization. Let's say I study at IIT, so at my institute, there might be a board or review board which might be called IRB. It is a committee basically which is responsible for reviewing and overseeing the research involving human subjects to ensure that it is conducted ethically and in compliance with regulations. They are following the proper regulations and they're keeping the rights and the ethics the rights of the participants in the mind while conducting the study. We cannot just test anything on any human subject, right? We have to be very careful about it. Now, the key functions of this IRB is protection of human participants. The we decline. Okay, the we sorry. So the protection of human participants, we want to ensure the rights, safety, and well-being of participants are prioritized, so that it is prioritized. Then the review of research proposals. We want that the anything study that is going on, it should make sense. It should be in in accordance with the norms, and it should ensure some ethical standards are being met. Now, this is covered, right? Safety and well-being protocols, consent forms, and methods are ethically set. Then there should be informed consent. You should have some written or some kind of consent from the participants that they are aware of everything that is going to happen in the experiment, and still uh, they are like agreeing for the experiment to be a part of the study. So they are fully informed risks and the rights before agreeing to participate. So we need to make sure. Now, the risk minimization, it ensures that the risks are minimized relative to the potential benefits, right? So IRB takes care of all these things. IRB approval. Now let's like go through the all of the options one by one. First is data collection can commence immediately. No. Firstly, you have to take an approval. You have to give a layout of what you are thinking for your experiment. Now, for example, I want to study the effect of uh, let's say medicine A on the participants. I have to tell that, okay, this might be a side effect of this medicine. I'm telling you in advance. And still, if you want to be a part of my study, then you are welcome. If a person then comes voluntarily that, okay, I still want to be a part of this study, given that the side effects are just like not much, so I will be fine after 1 day, so I can take part. So, uh, also like they can commence data collection. You should not start until you tell each and everything, each and every risk, each and every uh, outcome, I mean expected outcome, and the data collection measures, the data what else? Like any condition, anything, it should not be hidden. So everything should be well explained and well documented, and then you need approval. Only then, after the approval, you can start data collection, right? And IRB approval is optional. No, it is not optional, it is mandatory. Third point is true, which is it should wait until obtaining IRB approval. Fourth point is IRB approval is only necessary after completion. No, because you cannot start collecting data or even working on your experiment before this approval. So C is correct. Okay, next question is the control group serves as a baseline for comparison in assessing emotion recognition accuracy. True or false? I hope we're not going too fast and everybody is able to understand. Anchal is saying false. Anyone else? Okay. So what exactly is control group? Control group is an experimental research. It is a baseline for comparison when assessing the effects of an independent variable, such as accuracy of emotion recognition models. Now, what happens is control group is a group of participants. This is important, okay? Control group is a group of participants that does not receive the experimental treatment or intervention. Um, as we discussed, I have to study the effects of a medicine. Now, there is group A and group B. Group A is not receiving any kind of medicine, and group B is receiving the medicine, or here, as we can say, the experimental treatment or intervention. So, group B is receiving, group A is not receiving. Now, you can say that in group of 10 people I did this, and in this the other group I did not do. You can study the differences between the two, like uh, those who took the medicine, they experienced less stress, right? So that means you can conclude that the medicine worked, right? So it is used to isolate the effects of an independent variable by providing a standard. People without the medicine experienced this level of stress. However, with the medicine they take, they experience less amount of stress, right? So the baseline is the control group here. So we want to compare with the control group, which has not experienced the experimental intervention. Example, testing a new study method. A teacher is there and she wants to find out if a new study method is improving students' performance or not. Then the setup will be an experimental group and the other group will be called as control group. Now, experimental group will be students who are taught using the new study method, right? And control group will be students who continue to study with the traditional method, regular classroom. Now, what happens is they are given the same test after studying. Control group's result provide baseline to compare with the experimental group's results. The control group, they did not experience the new study method, so their scores reflect how students perform under normal circumstances. Comparing the two groups helps measure whether the study has a real effect on learning or not. Does anyone have any questions? Kanmani, or was it by chance? Uh, my network is facing some issues. Hi guys, I'm experiencing some kind of network issues. Can you hear me? Okay. Let me rejoin and just give me 5 minutes. My Wi-Fi has stopped working somehow, so I need to figure this out. On my device, it's not working. Please give me 5 minutes. I'll be joining back from my laptop. I think it's fine now, right? Can anyone please confirm? Am I audible and visible as well? Oh, am I audible now? Okay. Sorry for the interruption. I don't know what went wrong. My network was off. Okay. So we were discussing about the control groups, and control group is the one that does not receive the experimental intervention, and there is another called the experimental group where uh, we experiment, and then we can compare the results. So control group serves as a baseline. True. Next question is, what defines the acted or posed expressions category of emotional expression datasets? Data collected from individuals in natural settings, data captured when the actors portray specific emotions, data obtained through brain signal analysis, and data collected from individuals without their consent. Can you please write the answers in the chat box? This is a very easy one. We have already discussed it. Anjali Singh B. Others? Do you want to answer? Vishal, Shikha B. Correct. So we've already discussed this, that there are two kinds of emotional expressions as well. First one is uh, we discuss acted or posed, and the second category is naturalistic or induced, right? Now, acted are created in the controlled environment. In the controlled environment, where participants are instructed to display specific emotions, often through facial expressions or verbal cues. And these data sets, they typically involve actors. They are actors who are like professional actors because they can mimic those emotions more nicely, right? Uh, they can portray a range of emotions given any instruction. The advantage is that they provide precise control over the displayed emotions, making it easier making it easier to collect data with specific emotional expressions. Let's say you want to collect happy emotional, like for people who are experiencing happy emotions, right? Now, uh, if in a naturalistic setting, you will have to capture the pictures. For example, it is a facial image data set, let's see. Now you have to check whether the person is happy, but in the laboratory setting, what you can do is, you can just tell the there are suppose 10 actors. You can tell them that each one of you has to act happy, put a smile on your face. They can do that, and in result you will get 10 people with happy face, right? So it is very easy. You can just instruct and obtain the desired emotion. Second is induced. Induced data sets, they involve eliciting emotions. Eliciting means inducing, like producing some kind of emotions in a person from the participants through various stimuli such as images, videos, or scenarios. The characteristics are they're exposed to something that is expected to uh, make them feel a certain way, right? So they can evoke specific emotion and their emotional responses are then recorded. Advantages are it captures more naturalistic emotional responses that how I actually would feel genuine emotions, not the acted ones. And disadvantages are that it is more complex and it can be challenging. My happiness can differ from maybe Shikha, how she will portray an emotion, and maybe Anchal will also differ from what I will experience. So it is more variability is there, and it is difficult to manage. So interpretation might also vary. So we cannot have a standard thing for it. Naturalistic is uh, they're collected in the real world setting. So there are basically three types of this data sets. The second was induced because you are presenting some stimuli, right? You're presenting something, but then naturalistic is completely random. Let's say you put a camera in a park, right? And people are coming, they don't know that the camera exists, and they are just laughing the way they are normally laughing always. So they can be themselves, they can express them as they are not conscious about it. So that is the third way, but it is the most difficult. It is the most difficult to interpret or gather. They're collected in real world settings without artificial manipulation or stimuli or any kind of instructions. Then characteristics involved, they are observed and recorded as they naturally occur in everyday life during social interactions, conversations, or events. Now advantages are high ecological validity because they are the most closest to what people experience in the real life, and they reflect genuine emotional experiences in real life context. Disadvantages include that it is very challenging. Like it is you might also invade the privacy because you put a camera at a public place or any setup. Number one is that challenge. Number two is also that you don't know which category the person is actually like feeling. It is difficult to gather, as I mentioned. It is logistically challenging. It requires extensive time and resources. Then the labeling is also expensive. Um, Additionally, capturing specific emotional expressions may be more difficult than controlled environments. If I really want to capture someone smiling or frowning. So it might be difficult to capture those kind of emotions. Let's say jealousy. So in the naturalistic setting, it is very difficult to capture that kind of emotion. So yeah, it is a slightly different, difficult thing to deal with. So the correct answer for this is data captured when actors portray specific emotions. To summarize, there are three types of like methods that we can use. First one is the acted or posed, second is the induced, and the third one is the naturalistic. What characterizes the naturalistic display of emotions category? Data collected from actors mimicking emotions, data obtained through induced emotional responses, data captured in natural settings without actors portraying emotions, data gathered solely through physiological signals. Very easy now. Correct. Correct. C. Ha. This is a good question. Arrange in increasing order of data collection difficulty. Mind you, collection difficulty है ये. Induced, acted or naturalistic में से which category is the least uh, difficult, I mean the easiest to collect, then which one is the most difficult to collect? This one is important. Please write your answers. Try to answer. Kanmani says C. Anchal says A. Shikha says C. Vishal says A. So we have got two votes for C, two for A. Let's see. The correct answer is C. Why? Because acted means that you are telling people that okay, you have to give me a smile. So the easiest is to hire some kind of actors or professionals which can do whatever you instruct them to do. You can tell them to pose in maybe uh, express fear or anger. They can portray it very well. So easy. You can just give them the instruction and it is done. Second is induced. Induced is very difficult because you have to present them with a stimulus, anything that will induce the desired emotions. For example, you have to, okay, let me write it down. For acted, you just need the actors, need to instruct the actors. Then comes the induced. It's like slightly out of your hands how the person will react, but mostly if you like, you can use standardized data sets, stimulus or stimuli to induce certain emotions. And the third is naturalistic. I want a person to, um, I want to collect the data for happy emotion. Happiness is still fine, like you can find people smiling everywhere. But what if I want to capture something more complex? Maybe anxiousness, anxiety. So in acted, it is very easy. I can tell the person that you are feeling anxiety, just how would you feel? Then they can show the expressions. In induced, I can tell them to recall something. Like whenever, so imagine there's a stage, you are on a stage and there are 1,000 people in front of you. Then induced will be easy. The person might start feeling some kind of anxiety. But what if I want the same in the naturalistic setting? It is very, very difficult. Naturalistic, no control. We don't have any control. So, most difficult, right? I hope the doubt is cleared, right? Okay, next question is what characterizes passive or perception based emotion elicitation that we just discussed? Active, passive, we discussed, right? So, individuals perform specific behaviors to evoke emotions, are asked to watch some stimuli like images or videos to evoke emotions. Emotions are induced through physical activities or elicited through direct interaction with others. B. Correct. So, active we have already discussed. I won't discuss it again in detail, but let me go through it once more. Active emotional elicitation is that you're telling the person to do something, you are telling the person to actively engage in the process. I am telling you to think about something, you have to use your brain, you have to put some effort. But in passive, you're just a passive participant. That means you don't have to put some effort, you just have to look at something or watch a video, look at a picture, and then I will just record your response through some kind of sensor or maybe your skin dermal activity or maybe your heart rate, right? So In passive emotion elicitation, we have already discussed that it is uh, yeah, so we don't require direct effort from the participant, and hence out of these options, the second option is the most relevant because they are just asked to watch some kind of stimuli like images or videos to evoke emotions, right? Next question is how does active or expression-based emotional elicitation differ from passive elicitation? These points are about the active one now. Answer according to active. B. Okay, everyone is saying B. So, correct. Because let's read all four options. It involves observing stimuli to evoke emotions. No, this is a characteristic of passive. Second is requires individual to perform specific behaviors to emote. Yeah, yeah. This is active. Then third option is it focuses on physiological signals only. No, nothing like that. And fourth is it involves random interaction with the environment. No, random interaction is like it is more of a passive thing, right? So B is the correct answer. Then, why is it important to standardize the presentation method for images in a passive emotion elicitation? We all know that what exactly is passive emotion elicitation. You are showing some images which can induce a certain emotions, right? A certain emotion. Um, but why do you need to standardize the process? Angel says C, Kanmani C, Shikha says C. Vishal says B. So why do we need standardization? Standardization is required to maintain these factors. First is consistency. For let's say there are 10 participants. You want to observe the emotions, right? So standardization would help you to achieve the um, you can say same images are shown to everyone so that the responses are also same. What if you're showing just happy and sad images to one person and then fear and anger images to the other person? Then you cannot compare how people are reacting to it, right? So we need consistency, then we need controlled stimulus delivery. That means there are so many factors involved, like what should be the image size, what should be the color, it should be black and white, should be RGB, or the duration of exposure. If you have ever taken part in this kind of quiz or this kind of experiment, what happens is usually they give you some timer. Like for 10 seconds, the image will be displayed on your screen. After the 10 seconds, you will have to answer some question based on what you were feeling. So there is how long should be the image displayed? If you display the image for 1 minute, I will get bored. I will not even look at it. Then the experiment will be too long, right? I won't even participate it in properly. But what if the image is shown just for 30 seconds? 30 seconds is also like long enough. So we shouldn't, I mean, if it is an image, then 30 seconds is also too long, right? But what if 2 seconds is the duration? 2 seconds is very quick. I will just even look at it, it will disappear. I will not even get the time to process it. So 2 seconds is very less for my task. The ideal time will be something around 10 seconds in my case, what I'm telling you. So 10 seconds I can take a nice look at the image, and then I can also observe it properly, grasp the contents, and it will also give me the time window to actually feel some kind of emotion. So these are the factors we need to make the process standardized. Reproducibility should also be there. It shouldn't be very randomized, that any random images are being picked and then no, it should be always the same set of images being used. Then comparison across studies. If you don't have any kind of standardization, how will you be able to compare with the existing approaches? We need to compare with the similar methods, then we need some kind of standardization. Then ethical considerations are also there. Um, Maybe you tell me that I did the experiment in an ethical way, like I showed them the picture and then the responses were recorded. But what if, what if you are not even displaying the pictures, you're only displaying what you want to show in the results. So it's not fair, right? So to avoid any kind of biases, any kind of these like fake results, or so that we ensure that everything goes in a fair and ethical manner, and these consistencies we require. So, to ensure the participants experience emotions without any influence of the external factors. There might be many external factors, but we need to standardize the process. So, what are the disadvantages of using images as stimuli for passive emotion elicitation? Interesting question. Number one is high intensity of emotions experienced by participants. Second is short duration of emotional reactions. Third is lack of personalization in emotional responses. Invasiveness of the method. Answers is 1 and 2. C. Vishal says C. So, first point is this question is about if we present image as a stimulus. Now, uh, let's say I use some kind of image in which there is bloodshed, or a person is from a horror movie. There is a scene where like a person has his arm cut and blood is flowing. So it will be very fear. It should induce fear, right? Um, Will it be enough for experiencing that high intensity fear? No, it is just an image. Maybe the impact of an image is lesser than a video, because in video you know what is happening, like everything is in motion, it is real time happening, right? But in the case of image, it is just a static image. No doubt it will still induce some emotion, but the intensity is not that high. So intensity is not that high. In case of images, intensity is not that high. Second point is short duration of emotional reactions. What happens is if I show you an image, it will induce some kind of emotion. You will start experiencing fear, and after some time, you will stop experiencing fear because you will be neutral. But if it is a video, then during the duration of the video, for example, it is a 10-second video, then the 10 seconds you will feel fear for a longer duration, right? So in case of images, we usually experience shorter duration of emotional reactions. Third point is lack of personalization in emotional responses. You are um, supposed to react in a certain way. Let's say if there is, like I mentioned, there's blood, so you may experience disgust, and you can experience like fear or disgust. maybe in certain cases anxiety, but it is not something which is personalized. So there is a lack of personalization. Fourth is invasiveness. You're just looking at an image. It has nothing to do with the invasiveness. Like it is not invasive at all because you're just looking at it. It's not something that is intruding in your space. So it is non-intrusive. ज्यादा से ज्यादा क्या होगा? They will capture the facial expressions. Otherwise, it's not intrusive, right? So the correct options are this 2 and 3. So this one is incorrect, this is correct, correct and incorrect. Okay, which of the following statements with respect to video stimuli are true? Now we're talking about videos. Number one, video clips can induce higher emotional intensity compared to static images, leading to a more vivid emotional experience. Second is, video clips can effectively evoke complex emotional states such as shame, guilt, or empathy, which may be challenging to induce during using static images alone. Number three is participants who have seen the video clips before may have altered emotional responses, diminishing the ecological validity of the study. Vishal, do you mean option A or only one is correct? Hmm. Vishal is saying A, Anshul says D. So the correct answer is D. Why? Number one. Point number one says video clips can induce higher emotional. As compared to simple images, videos definitely provide higher emotional intensity, as I just discussed in the previous question, right? Second point is video clips can effectively evoke complex emotional states. Looking at a given image, it can just induce some basic emotions. But what if there is a video clip, like something is happening? Let's say there is some kind of, there's a video of a student cheating in the exam. So maybe the student is shown the video and then he can see that, oh, I shouldn't have done that. Then the shame that he is feeling, or even let's say something bad has happened, and then as the people of this country, overall we should be feeling bad about it. So given an image, it is very difficult to convey our point sometimes, but in the case of videos, it is much, much easier, and it is easier to induce guilt, empathy. These are some complex emotions. Unlike happiness, sadness, anger, they are more straightforward, but these emotions, shame, guilt, empathy, they are more complex. So, uh, in that case, videos work better. So they can handle, or we can say induce, complex emotions in a better way. And third point is participants who have already seen the video. Let's say there is a video which is funny, and then you are supposed to laugh at it. Now, I show you the video once, you laugh at it. Okay, fine. Then you have already seen that video, you've already watched, and I will show you again and again. Then you won't experience the same amount of laughter, or you it will be boring to you, so you won't be engaged that much. So participants who have seen the clips before may have altered emotional responses. You were supposed to laugh at it, but now you are like just smiling, hee hee. You're like, okay, fine, I have already watched it. You're bored. You're not uh, laughing. So it altered your expected outcome. So that means if you include these factors in the study, if there is some kind of this mismatch is happening, then the study will not represent the correct, it will not represent the real world, because usually then people will laugh about it. The reason that the person did not laugh is because they've already watched it many times. So of course it the person has already been bored of it. That's why. So third option is also correct. Then why might be it important to show a neutral baseline film before presenting the emotional clips? Number one, to ensure participants experience a variety of emotions. Number two is to establish a consistent emotional baseline among participants. Number three is to enhance the intensity of emotional responses to subsequent clips. Number four, to minimize participants' emotional reactions to the subsequent clips. Answer says C. Vishal says B. Shikha says B. Okay, so let's discuss these options one by one. First is what is the question? Question is that you have to why is it important? It might be important to show a neutral baseline. Since we are dealing with emotions here, correct? Now why it becomes important to show a neutral video? Let's say we are showing videos, okay? The reason is number one, to ensure participants experience a variety of emotions. No, it does not depend on that, because ultimately, whatever you are going to show, the participants will react that way. It has nothing to do with what a neutral baseline is helping you with. No. Second point is to establish a consistent emotional baseline among participants. Let's say I am in a bad mood today and I will not laugh. I don't want to laugh. I don't want to talk to anyone. I'm more frustrated. Uh, okay, it was an unproductive day, whatever be the reason. Now you tell me to take part in an experiment. My emotional state is already on the negative valence side. So it might be possible that a that a video that you find funny, the other person is finding funny, I might not find that funny, right? So what is happening? Matlab, your emotional response is varying based on how your mood is, your prior emotional level is, right? So you need to bring the emotional level for everyone at the same level before starting the video, actual experiment. That is why you need to have a neutral baseline film before presenting the emotional clips. So second option is correct. Let's check the third and fourth as well. To enhance the intensity of emotional responses to subsequent clips, no, it does not do anything for the intensity. It just is very personal, and the intensity might be impacted by the stimulus itself. We cannot do about anything using a neutral baseline. Fourth is to minimize participants' emotional reactions. No, we don't want to minimize the emotional reaction in any way. We actually want to maximize it so that there are more discriminatory information we have. So the correct answer is B, right? Question number 20. What is a common duration range for video clips used in emotion elicitation research? We've already discussed this. Very easy one. Anshul says C. Others? Vishal says A. Shikha says C. Hmm. Now what happens is that if I show you a video clip for, let's say, 5 to 10 minutes. 5 to 10 minutes is a lot. It is a lot of time. Why? Because within 5 to 10 this duration, your emotions can fluctuate a lot. Am I right? Because a scene, usually what happens is whenever we feel laughter, it doesn't last for like 5 minutes, you're laughing and laughing. It doesn't work like that. Usually, there is a spontaneous rise in emotion and then you feel neutral. So, this is suppose the neutral level. This is the neutral level. And then suddenly you start feeling happy. And then you reach the state of happy and then you back to normal. So usually this time is not 5 to 10 minutes. It doesn't take you to change your emotion this much, amount of time. No. So 5 to 10 minutes is definitely long, and hours definitely. In an hour, it is a complete movie you can watch, and it is a amalgamation of so many emotions you can experience. We require to capture only one emotion at a time. That is why we take very short clips. 1 to 2 minutes is also very much. So the best duration is 20 to 30 seconds. Because if you imagine there is a scene going on, maximum in 30 seconds you can uh, feel an emotion and then you can uh, I mean, you can experience the emotion and then get back to neutral. That way, it will be giving you enough time to experience the emotion properly and not too much time to just experience too many emotions in a single video. If that makes sense. Oh, I think the answer is correct. I mean, it is marked as wrong. 20 to 30 seconds is usually for one emotion. Um, 1 to 2 minutes is usually very high. 5 to 10 minutes is definitely high. It is definitely wrong. It is also incorrect. 20 to 30 seconds. If you want to elicit a single emotion, I would say 1 to 2 minutes is not acceptable in my opinion. But 1 to 2 minutes can be used in 20 seconds in neutral and 1 to 2 minutes for emotional. Usually, like the scenes, they are they are able to convey the message in what I see is in 20 to 30 seconds, but 1 to 2 minutes can also be the case if the scene is taking long. For example, let's talk about some advertisements. Now, advertisements are meant to um, invoke some kind of emotions, right? Let's say there are some very emotional advertisements on TV which are aired. Um, Maybe something related to your family. So it can also go up to 1 minute. So if like in work, I think it is also acceptable, but usually the prompts should be around 20 to 30 in my opinion. So maybe the answer is this in my according to my understanding, but this is also acceptable, but definitely the options 1 and 2 are not acceptable. So we will check this out, okay? Why, okay, next question. Why is this advantageous to use pre-validated video datasets for emotion elicitation research? Number one, they allow for greater flexibility in creating customized emotional experiences. They provide a standardized set of stimuli with confirmed emotional effects. They ensure a diverse range of emotional responses from participants. They reduce the need of participants to provide self-assessments. Very easy one. There's confusion, I see. So Anshul says C, Vishal says B. What happens is, usually we require a standardized set of stimuli with confirmed, pre-validated means they have labels. Let's say there is a funny ad. If you remember, Cred used to create so many funny ads, and uh, they're very like innovative, right? So if you watch a ad by Cred, you will feel amused, you will feel happy, or you laugh about it. So there is a validation. If a person has validated, okay, this ad is associated with happiness or amusement, then whenever you are showing that Cred ad to someone, you are expecting that behavior from them. So you need the predefined labels for that. There should be no confusion. So if you use more standardized, if you use pre-validated data sets, video data sets, that means you have the correct output confirmed. Then you can compare whether it is actually inducing, like it should induce happiness. Now you're suppose capturing the facial expressions. Facial expressions should represent happiness or amusement. So I'm maybe for me, happiness will be slight smile. Maybe for other person, it may be laughter. So in both cases, you should be able to capture, but then you can compare with the ground truth what exactly was the target emotion. So that way we can have a standardized set of stimulus with confirmed after effects, with confirmed emotional effects. That is why we use these pre-validated video datasets. Let's say you use a non-standard dataset. Uh, you just show random videos. But then how will you compare? Suppose person A behaves another way and person B behaves another way. Then uh, what will you call that? What exactly the video is all about? What emotion does it represent? So the best answer is they provide a standardized data set. Next question is, what does emotional latency refer to in the context of stimuli presentation? The duration of emotional experience after stimuli presentation, the time taken for an individual to process emotional stimuli, um, the intensity of emotions, the delay between presentation and onset of emotional expressions. What is the best definition here? So, emotional latency, what it means is, it means the delay between the presentation and the onset of an expression. Uh, what does it help us? It helps to understand how quickly the individuals recognize and react to emotional stimuli, providing us valuable information about cognitive and affective processes. For example, there are two persons and they're watching some video, which is a stand-up comedian. Now he cracks a joke, and then person A laughs instantly, and then person two, he takes some time and then laughs. That means he is like cognitive processing is slightly slower than the person A. Person A is very smart. They just quickly got the joke, laughed about it. The emotional latency is less. But the person B, they need to think about the joke again in their head and then process and then laugh. So that means they're taking more time. The cognitive load is higher or whatever you want to study. So uh, one application is this. Then the differentiating emotional responses also, by analyzing the latency times, researchers can also differentiate between fast acting and instinctual responses. Let's say reflexive fear, or let's say like you show there are some funny videos, normal videos going on. Suddenly, there's a ghost which pops up, and then you will like experience fear suddenly. The latency will be very less. But when you're looking at something which is inducing, suppose, happiness or sadness, then it might take some time to induce that. Because you just don't look at something and feel sad. You need some time to process. Let's say it's a video, then you will see at the end, suppose your favorite hero dies, you will feel very sad, but then it takes a lot of time to process. But the reflexive emotions such as fear or anger or this anxiety, like anxiety is also not reflexive actually. Let's say fear only. They are more faster, but other can be more slower, like judgments, etc. It can be slower. So based on this emotional latency, you can judge. Then they can be used for diagnosing and monitoring conditions such as mood disorders. Maybe your mood changes very quickly. You might have some disorder, anxiety disorder, trauma related disorders. So you can differences in these this emotional responses, the latency can be observed for patterns, and then can be used further in clinical applications. Then predicting behavior is also there. Understanding these differences between the contexts can also help. Then intervention and treatment. So, anyways, emotional latency is very useful. Now, the correct answer is the delay between the presentation of the stimulus. I've already shown you something. So, this is the point where I start my video, and then you started processing, and then you start showing the symptoms of, not symptoms exactly, I mean how you feel. Suppose this is the peak happiness, so you took some time to process it. Like this is called the emotional latency. Then after that, the emotional intensity starts dropping, right? Which active method of emotional elicitation involves asking participants to mimic specific facial action units associated with certain emotions. What are facial action units? There are some points on the face, like lip corners, eyebrow corners, right? So which method can be there? Recall method is no. This is not mimicking the actions. Recall means remembering something, right? Directed facial action tasks, image-based method. Image-based method is a passive one. Social interaction method, interacting with each other. No. Social interaction means having conversation with each other, interacting with each other. Then the recall method we've already discussed, to remember something, to recall some incident. Then comes the directed facial action. As the name suggests, you are directed to perform some kind of uh, facial actions to mimic some certain emotions or expressions. Then the image-based method, it is a passive method. ठीक है? So the correct answer for this is directed facial action task. Next question is, we've already discussed about IRB, Institutional Review Board, right? Which aspect of an experiment is the least important with respect to IRB? Number one is potential risks associated with the experiment and measures for protecting privacy and anonymity, informed consent forms, number of participants, clear description of research methodology. Shikha says C. It's correct, Shikha, because the first point the first point is potential health risks, we definitely need to include in the IRB, like the proposal that we are forming for our creating for our experiment. We definitely need to all list down all the possible uh, risks associated with the experiment, and the even the advantages also, the disadvantages also, everything associated with it with proper clarity, and measures for protecting the privacy and anonymity of the participants definitely you have to include. Second point is informed consent forms. Definitely yes, because we have to tell the participants that these are the conditions. This is going to happen in the experiment. Do you really agree to be a part of the experiment? Yes. So we need this. Number of participants does not matter. Once the whole setup, whole pipeline, whole experimental setup is approved by the IRP, then you're free to include as many people as possible. In fact, the more people will participate, then it represents a better set of a population. So it is not that important. Number four, clear description of the research methodology is definitely required because we want to explain each and everything what exactly we are going to do, what are the objectives, what is the description of the research methodology, what is the problem statement, everything in detail. So I'm just skipping the text because we have time limitation right now. I want to cover all the questions. So yeah, correct. Next question is, a single set of facial actions can become different emotional expression in different contexts. True or false? True. Yeah. So emotions and contexts, a single set of facial actions can manifest as different emotional expressions depending on the context. Essentially, what happens is the facial expressions can be influenced by different factors, maybe social factors or environmental factors. Uh, Example, at what time, what place you are there, right? Let's say a person is smiling. Now, if the person is standing in the middle of a argument is going on. Now the argument is going on, the person is smiling, that represents the insensitivity of that person. But same if there's some certain event is happening or somebody is getting married, let's say, then the person is smiling, that means they're happy, they're feeling happy for the people. So, another example can be a smile can represent happiness in one context that just I described right now, but it might also convey politeness or nervousness or even sarcasm in other contexts. So we need to know the whole context. Similarly, furrowed brow can indicate concentration, like I'm just looking at something with full concentration, or it can also represent some kind of confusion or anger, depending on the situation. So yeah, different emotional expressions, uh, it can become different in different settings. Next question is, which of the following can be a parameter to define the inclusion exclusion criteria of a study? Inclusion exclusion means what you can include, what you can not include, what you don't want to include in your study. So are these criterion uh, impactful to when you're designing your study? Yeah. So age can be a factor. If you want to experiment on young people versus old people, yes, you can do that. Then the gender, male versus female. Literacy, maybe some people who have not studied, and maybe some more literate, highly educated people, they can have different perceptions. They can have different perceptions. So yeah, all of the above can be criteria. Then what is the main next question is, what is the aim of the abstract in an IRB application? To convince the importance of research, uh, to convince that the researcher has sufficient expertise to inform about the research materials and procedures and to inform about the results. Abstract is a very generic term in research papers also. Abstract is something that summarizes the whole paper, the whole research. No, Shikha. The correct answer would be C, because as I mentioned, abstract means summarizing everything. It's not about the results. Results, and mind you that you are talking about the IRB. IRB is the consent is taken before the experiment. It's not about the results. It's more about the procedures, like what you are going to do, how you are going to do, what you aim to achieve. All of these things you need to take care. Okay. Next is, what is the main function of the protocol section of an IRB application? Now, protocols is a set of rules. So, would it be A? It should summarize the entire project. We just saw that it is the purpose of an abstract. Due to time limitation, I'm not going in detail with the components that are included in IRB. So you can refer to these slides later and then check. But there are certain components of the IRB. So the entire project summary is in abstract. So first is incorrect here. Second is, it should provide a convincing argument for why the research is important. It should contain the professional qualifications of the researchers. It should detail how researchers intend to obtain informed consent from the participants. The protocol section. Okay, sorry, my bad. The protocol section is, yeah. So here protocol actually means the research proposal. So it is actually an abstract only, but it gives all the whole like experiments summary, and it tells us about the purpose, objectives, methodology, and procedures. And then there are other components. Okay, so yeah, it typically includes a research proposal, which so abstract is a part of the research proposal or the protocol. Protocol is a set of rules or whatever you're going to follow. So essentially, it is the same in this case. That's why I refer to the terminology here. So yeah, it provides the summary. The second is, provide a convincing argument for why the research is important. It is already included in the like summary. So it is a subset of the protocol. So essentially, it is a summary. Okay, SAM mannequins is used for data collection, data labeling and annotation, continuous emotion representation, all of the above. Do you know about SAM mannequins? So, SAM mannequins are some figures. I'll show you. These are called self-assessment mannequins, SAM. So, you must have seen these kind of uh, figures. So, if you're feeling suppose after you watch a video, you these will appear on your screen. So, each row represents a single dimension. Let's say VAD model is there. So, this will represent the valence. See, this is sad and neutral, and then this is happy, right? So, this is the valence part. Then this is the arousal. You can see this is more relaxed, the heart is racing faster and faster, so this is more aroused or excited. And then this is dominance. Dominance means you feel powerful and you feel confident. Here you can see a bigger this mannequin, bigger size represents that you feel more dominant, but here you think little of yourself, so that means it is underconfident. So this is more of a submissive, right? So yeah, valence, arousal, and dominance. And usually we use these figures so that it is easier to know what exactly you are feeling because you can just look at this and relate to it. Or anyways, visual things are more relatable than just the theory. So SAM mannequins is used for data labeling and annotation because after watching something, after experiencing something, you have to tell your experience. So you are essentially labeling the data, and then you're also responding. Data collection, no. This is correct. Continuous emotion representation, no. This is discrete emotion representation on a scale of, let's say, 0 to 9 or 0 to 5, something like this. Then, this is the second last question. We have only two questions left. So, this question is, determine the correct order of events in the experimental design. Experimental design means how are we going to plan our whole experiment? You need to have a design in mind. So, let's discuss this. Usually what happens is whenever you want to design an experiment, let's say you want to know that my medicine is going to work or not. First step will be you have to have some study concept in your mind. So you need to develop some theory like my medicine is there, it should perform well. Now you should decide the type of study. We already discussed within subject, between subject, and mixed model. So within subject means same people. Between subject means different set of people. Mixed is a mixture of both. So mixture is basically you can design it your way. Then comes how many groups are you going to take? How many will be control groups? How many will be, other groups? Then experimental groups. So next step is determining the sample size. How many people are you going to take in a particular group? Then determine the methods of evaluation. Okay, you are done with the experiment. Now you want to tell me, you want to take feedback from me. How are you going to take the feedback? Are you going to take the self-assessment like something like SAM? We just discussed SAM's interviews. I can ask you personally, how did you feel? So you can tell me observations, task performance, psychophysiology, like maybe you can also use some kind of sensors. So, what is the mode of evaluation? Then you decide the study location. Is it going to be a naturalistic setting? Is it going to be a maybe in the laboratory? That kind of factors. Then other type of equipments. Whatever equipment do you require, you need to figure that out earlier. Then what are the failures and contingencies involved? Like what can be the possible failures? What can be the possible um, risks involved. So develop study protocols and script. Protocol, as we discussed, is the complete summary. Okay, and then determine the methods of recruiting participants. Are you going to float a form? Are you going to advertise on social media that okay, be a part? How do you want to give them some kind of money in exchange of participation? So, like that, you have to decide. Then you have to prepare the IRB documents. Now you're just planning everything, right? After that, you start recruiting participants. Once you get the approval from IRB, then you get to recruit the participant, and then you can start conducting the study. So this is the last step. Conducting the study is the last step. Firstly, this much you have been doing. It is just for the IRB. You need to have a plan, and then need to get it approved. After that, you can go for it. So the correct order is firstly, we need to develop a study concept. Then we need to determine the study design. After that, the design is there. How many groups will be there? How will be assessments will be there? Study location is also determined. After that, the evaluation mode is determined. Uh, you need to prepare the institutional review board report, then you can conduct the study. Last question, probably, I guess. PsychoPy is a tool for data annotation, data collection, affect classification, or affect expression. So, PsychoPy is basically a tool for experiment planning and data annotation. Sorry, not annotation. This is for data collection because it gives you freedom to design your own experiment. What essentially happens is like this is you can see the interface is there. Now you can design how long the image will be displayed. After, for example, this is happening. Next step will be this. Then uh, display 10 images and then move ahead. So you can design your own timeline. Let's say fixate. Fixate means this is the like the baseline. After this baseline, after 2 seconds, you start presenting the stimulus. Then there is some kind of mask. Then you get the time to respond after 2 seconds for this much amount of time. So it is plan. It gives you the freedom to plan your own experiment in your own way, right? So this is a PsychoPy tool. There are multiple tools which are available. Then every tool requires its own expertise. Every tool works in their own way. These are the components that PsychoPy provides. It provides experiment builder, stimulus presentation, response collection, programming environment, data logging, it has cross-platform compatibility, and then integration with external devices. For example, uh, you want to what you can say you want to note down the heart rate or some skin conductance. So you can take the sensor and somehow connect it with the software. So it also gives you that freedom. So PsychoPy is used for data collection. Okay, we discussed a lot of questions today, and the session was I think it went very fast today. I hope you understood some concepts. And even if you don't understand, you can ask me in the next sessions, or you can also refer to the slides and the videos later. These videos are being recorded, as you know, and it will be provided. Even the slides will be provided for those questions for which I did not, you know, go in detail. You can refer to the content that I have provided, and I think it will be able to clear your doubts. So we're already late, but I have to end the session. Uh, if you still have any doubts, you please feel free to please feel free to ask in the chat box. Shikha, please wait for 1 minute. I will provide you the links. Do you want the link for the YouTube videos? I will write in the chat box, okay? So this YouTube link I'm sharing for the last video. You can go to this channel and have a look. It also features videos from the previous editions, but I would say that you check from the recent edition because I have added some more questions from the 2024 edition as well. And the drive link will also be shared with you. Let me share if I think the team must have shared with you, so you can go and check it out. So the next session we will be having on 18th Feb, and the timings are same, 6 to 8 p.m. every Tuesday. We are having the sessions till the end of this course, and I assume that you don't have any doubts. Nobody has written in the chat box. So I will end the session now, and I hope that we learned something today, and I hope to see you all in the next session as well. Thank you for joining, guys.